It's 6:48. Right, doctors should be more cautious before prescribing Ritalin to tackle attention deficit hyperactivity disorder, ADHD. Now, this is according to a study published in the Cochrane Review, which says that much better research is needed to establish how effective the drug is. One of the authors is Dr Morris Zwi, who's consultant child and adolescent psychiatrist. He joins us now. Good morning.
Good morning.
I remember we did a phone-in on this maybe 4 years ago, and one mother rang up and said that all 4 of her children were on Ritalin to calm them down. Is it all too often a kind of fallback for badly behaved children? Because, you know, some will testify that it's a miracle drug.
I think that's right. There are very conflictual views about methylphenidate, the proper name for it, the generic name.
Yeah.
I think that arises out of the fact that we're talking about giving psychoactive medication to children. But there does seem to be a small group, it's roughly 1 to 5% of the child population, who appear to have extreme difficulties with inattention. They're hyperactive and fidgety, they can't sit still, and they also are very impulsive. And ADHD, that's what constitutes ADHD. It's excessive inattention, hyperactivity and impulsivity present to the degree that it actually causes impairment to them. Now, the issue about whether you use medication or don't use medication is a very, very important one. And what's important is that people are assessed properly, and only those who actually have the condition are treated.
Is the condition absolute, or is it on a spectrum?
Oh, no, it's on a spectrum, and that's one of the difficulties. There's no objective test that you can do to say, okay, this person's got ADHD. It's not as if you can do a scan or a chest x-ray as you do with pneumonia. But the importance of what our study is about is really that we've examined the literature, and through a Cochrane review, which is a systematic review that's transparent, that looks for all the best evidence and pools the results together. And we did show that there does seem to be a modest improvement in ADHD symptoms, in behavior difficulties, and in quality of life for those who have ADHD. But we also know that there are common side effects, and these are also shown to be an issue. For example, it can affect sleep and it can affect appetite. Those are the most common adverse effects. But the underlying concern that we have is that although there's more evidence, more research in this area of child mental health than any other area, the quality of the underlying trials was not very good, and in fact was quite poor overall. And this leads us to be uncertain as to whether the changes that we see in ADHD symptoms and behavior is actually real, or whether that might have arisen through biased observations.
Okay, well, that's an interesting point. We're going to leave it there, and we're going to no doubt hear from parents on this, as ever. The ultimate focus group are many listeners. Thank you, Dr Morris Zwi.